Bismillahirrahmanirrahim. Assalamu alaikum. A 36-year-old woman, gravida 2, para 2, come to the office due to 2 days of right breast pain. She has had fever, chill, muscle aches, and fatigue. The patient had a spontaneous vaginal delivery 6 weeks ago and has been breastfeeding her infant. Her husband her husband has been feeding their baby pumped breast milk so that her wife can rest at night. The patient has no chronic medical condition and takes a daily multivitamin. Her mother was diagnosed with metastatic breast cancer at age 55. Temperature is 38. Blood pressure is 110 by 60 and pulse is 84 per minute. Physical examination show a 5 centimeter area of erythema, induration, and tenderness at the right upper quadrant of the right breast, as well as right axillary lymphadenopathy. There is no flatulence. The left breast has no abnormalities. Which of the following is the best next step in management of this patient? Discontinue breastfeeding and prescribe antibiotic therapy. Order a breast ultrasound and mammography. Order mammography and core needle biopsy. Perform incision and drainage and prescribe antibiotic therapy. Prescribe antibiotic therapy and continue breastfeeding. Recommended non-steroidal anti-inflammatories and warm compressor only. So this patient is 36-year-old woman. She came to the office for having the right breast pain, which is associated with fever, chill, muscle aches, and fatigue. The patient has spontaneous vaginal delivery 6 weeks ago and has been breastfeeding her infant then. Her husband feed their baby with pump breast milk so that her wife can rest at night. On physical examination, which show a 5 centimeter area of erythema, induration, and tenderness at right upper quadrant of breast, as well as right axillary lymphadenopathy. The left breast show no abnormalities. So, based on these, hence the diagnosis of this question is lactational mastitis. Lactational mastitis, and the management option for the lactational mastitis is prescribe antibiotic therapy and continue breastfeeding. So here the correct option is choice E. Why the choice E is the correct one? Because this patient has lactational mastitis, a common infection in breastfeeding women due to inadequate milk duct drainage from pumping breast milk or poor latch. Other risk factors include infrequent feeding as seen in this patient, sleeping through the night, nipple excoriation, and rapid weaning from breastfeeding. Patients with lactational mastitis are diagnosed clinically and typically have flu-like symptoms, for example, fever, myalgias, focal unilateral breast pain, and with surrounding erythema and induration, and axillary lymphadenopathy. Staphylococcus aureus from infant nasopharynx or from the maternal skin are transmitted through the nipple and multiply in stagnant milk. Treatment is with methicillin-sensitive Staphylococcus aureus with dicloxacillin or cefalexin. Patients should also continue breastfeeding every 2 to 3 hours because direct feeding from the bilateral breast drain the milk ducts. Come to the incorrect one. Choice A, discontinue breastfeeding and prescribe antibiotic therapy. So discontinuing the breastfeeding will worsen this patient's symptom as bacteria grow well in stagnant milk. Choice B and D. I will explain choice B and D together. Choice B, ultrasonography is indicated to assess for breast abscess, which can present with fever, unilateral breast pain, and flatulent mass. Treatment of breast abscess include drainage and antibiotic. Choice C. Mammography and core needle biopsy are indicated in the evaluation of inflammatory breast cancer. Patients typically have powdery orange skin thickening and edema. Choice F. Non-steroidal anti-inflammatory drug and warm compressor are used in patients with breast engorgement. Patients with breast engorgement have bilateral breast pain with generalized rather than focal involvement.